Open Enrollment in the Affordable Care Act's marketplace is underway. This is HealthCare.Gov, and Open Enrollment started November 1st and runs until December 15th, 2020. This is for health coverage that begins January 1st, 2021. And the Centers for Medicare and Medicaid Services have been keeping track of how many people are enrolling in coverage and how many people appear on those application forms. We're going to share some of that information today. The data that they collect measures activity that runs Sundays through Saturdays, and we're halfway through. At the halfway mark, we're seeing that the marketplace is doing quite well. We're at a faster enrollment pace over last year, and it was a smoother start. No technical issues on the site like last year, if you remember. There are different numbers of states using the federal marketplace this year. New Jersey and Pennsylvania have started using their own state-based marketplace. So we're not going to do a comparison of this year's numbers for who's using the federal marketplace over last year. The data would be a little skewed. It's about a 7% difference if you pull those states away. It is about 36 states that are using HealthCare.Gov, and the numbers at the halfway mark are pretty good. We've got about 2.38 million people that have made plan selections. About 22% of them are brand new to the marketplace, and that's expected. Usually we do see the majority of applications being renewals. People are coming in, even if they had a health plan in 2020, and looking at what their options would be for 2021, making a plan selection and renewing that coverage. The consumers on those applications at the halfway mark is about 3.7 million people. HealthCare.Gov users is closer to 8.2 million, and that's unique users as of week 3. That's people that are shopping, looking at plans. It includes about 500,000 window shoppers, but a lot of people clicking through the pages on HealthCare.Gov to learn more about their health insurance options. Now, at this halfway mark, we still are averaging about 800,000 people, just shy of that are looking at plans, making those plan selections each week. That's a pretty good pace, but we only have a couple weeks left. We only go until December 15th. So it's the time when we try to urge people, make sure you visit healthcare.gov and you start looking at what your options are. Now, to window shop, like we said, which about 500,000 people have found to be quite helpful, it gives you an opportunity to look at the plans, the prices. You can sort plans. You can do a comparison. If there are two that you like, you can put them side by side and see where they differ. You can sort by premiums. You can sort by deductibles. There's a lot of options for doing that very comprehensive window shop before you actually make a selection. So as you do your next steps and prepare to get covered for 2021, visit that C-Plan site, and we link to that in the description below. Get organized too. Make sure you know the birth dates, social security numbers, or immigration information of the people in your household, the household income, employer information, and have a last year's tax return handy if you've got it. Makes it a little bit easier to navigate through some of those questions that appear on healthcare.gov. Now, again, make sure you do this before December 15th. And it might be a little bit different this year if you've had some fluctuation in income or household size because of the COVID pandemic. There is help available. In Wisconsin, you can find that at wiscovered.com, and we linked that in the description below. If you're not in Wisconsin, if you find your way to healthcare.gov and scroll to the bottom of the page, you're going to see a link that says Find Local Help. That will get you to some assisters that are a little bit closer to you. And then, like we said, healthcare.gov is the site you're going to find to actually do that enrollment and make your selections. And again, do it before December 15th.